I am chairman of the Department of Urology and Kidney Transplantation. I'm the section chief for the male infertility, andrology and infertility. I'm currently also serving as chief of staff for the hospital, so I'm wearing many hats. At the state level, I'm president of the Ohio Urological Society, which serves all the urologic needs, and it's a professional organization for the urologist. At the national and international level, I'm immediate past president for the IAUA, which is International Urology Association. So involved in teaching, involved in clinical care for the patients, involved in research, innovation. I loved my time at University of Toledo. When I joined, it was called Medical College of Ohio, MCO. The reason I chose this program was this was one of the 12 programs in the country at that time where urology and kidney transplants were done together. And my passion was to follow transplantation. What I got from University of Toledo was excellent training. And more importantly, there was a lot of humanity and empathy that I learned from my teachers. Being a small program, you knew your faculty very well, and your faculty knew you. You followed them not only professionally, but how they interacted with patients. This was not a patient mill where you were seeing 100 patients in and out. Patient was a number. This was more of a human touch. Patient will come in. Many times you will see little kids, they'll come and hug their urologist. You knew your patients, their families. So that personalized care, before that became a buzzword, was a reality at MCO. And that's what Toledo gave me. And I took it and kept it all my life. Any rotation I went to, any clinical rotation, I loved it. Then my good friend, his mother, during my med school, had some kidney trouble. She was on dialysis, and I got exposed to what dialysis, what transplant is. We together took care of her. Unfortunately, she passed away. She never made it to the transplantation process. And so I wanted to pursue it further. It just fascinated me, what transplantation was all about. And that's how I ended up pursuing my career in urology. I made a niche for myself because I established the male infertility clinics, both in Louisiana, which was my first job, and then at the University of Oklahoma, where I was for 12 years. So I found the perfect blend of office procedures, long-term care for the patients, establishing relationship with them, and doing big cases in form of transplantation. So urology was a perfect fit for me. It means a lot. It means I have more responsibility on my shoulders than ever before. When I left Toledo and took my first faculty job at LSU, I knew I represented Toledo and my teachers. In my culture, they say there are 3 types of debts that you cannot repay. First debt is debt to your parents. You pay it forward when you are a parent. Second debt is being a teacher, for the teachers. Whatever your teachers taught you, made you who you are, you cannot repay it, you have to pay it forward. So I'm involved in training the next generation of medical students, residents, and giving them what I received. And the last debt is debt of nature or existence or divine, whatever you want to call it. You just have to make sure that you take care of nature and don't exploit it, and take care of next generation. This award makes me feel that I have to pay forward what I received from Toledo for the next generation of students and residents. When I was chosen for the international scholarship for American Urological Association and in liaison with the Indian Urology Association, I was sent on full scholarship to promote transplantation to India. It was a big moment for me, to go back in an area where deceased donation was not even heard of. So sharing my protocols, techniques, training the urologists over there, getting their transplant programs off the ground for deceased donation. When I was in Oklahoma, the transplant program over there was not doing too well. So when I took over as director of the program, I started the living donor program over there, and I was in charge of the pediatric renal transplant. And we were awarded the UNO certification, and we got the silver award, medallion award, beating all the pediatric renal transplantation programs around our area. We were one of the programs where there were best outcomes, shortest wait period for children. And getting those hugs from kids after their kidneys were placed and they could eat pizza, that was a very fulfilling moment. Establishing your infertility clinic, the first of its kind in the state for the male infertility, that was very fulfilling again. And Northwest Ohio did not have any minimally invasive prostate cancer treatment. So starting the HIFU program for the patients so that they have an option for their prostate cancer treatment apart from just surgery and radiation, getting that off the ground and becoming one of the leading programs in the country where we did HIFU, which is high intensity focused ultrasound for the prostate cancer. That put Toledo right on the map, growing my transplant program here. Now latest thing is aquablation, which we are one of the very few academic centers. I think we were 9th in the country when we started the program. This is a treatment for enlarged prostate, where you don't have to cut open or do the conventional, roto-rooter, what they used to do. I can't pick any one thing. I wish I could, but the life is, you go from one thing to another and you try to do it well. I was a chief resident, and it was a very busy week. So I remember feeling really tired and just stressed, and my 4-year-old son and my daughter, who was less than a year old, my wife just came to give us a surprise visit. And I remember going to the cafeteria, and despite being so tired, just looking at the kids, and all your tension, all your stress was gone. It just centers you why you're doing what you're doing. My son loved being in cafeteria because I used to get meal tickets, and he used to eat pecan apple pie. And for him, the hospital was where there's a lot of pies and cakes. So on a professional front, I think Dr. Kropp, who was our chairman, he used to have a resident share a very fine cigar at the graduation party. So getting that cigar from him was an award, and sitting with him and being in his presence and getting acknowledged for your work, I think that was a proud moment. Dr. Kropp was a big influence, a thorough gentleman, very professional, very calm. You learned from him how to maintain your composure, how to treat everybody with respect, and true and genuine empathy, not just a facade. Great person. I learned so much from everybody. Rick Keck was one of our research technicians. He taught me first time how to operate on little mice. That research project was nationally recognized, and even at AUA forum, we got excellent reviews and won awards. He impacted my research skills a lot. Pat Carter was our secretary here. She would routinely take care of our son so that my wife and I could get a break and have some time together. And my wife was just a big help, and she was the pillar through residency, through my career, and I can't repay these people enough. They made me who I am. In this culture and society, the name stamps sometimes can bog you down. I just want everybody to know you are second to none when you train in Toledo. UTMC, the program is solid. The education you get, the clinical training you get, it's second to none. I just can't tell you how proud I am of this institution, not because I am here now, because what it made me in my life and where I could go without any concerns. So be proud of who you are, and balance your work and life, because just remember, work is part of life. It's not life itself. Cherish your loved ones, your kids. I wish I would have gotten that advice when I was younger. I think Toledo is a great place to raise your family. The culture here, the Midwest mentality, everything is wonderful. People truly are genuine and they care about you. So be proud of Toledo. I think I want my legacy to be remembered as a good, kind human being. You can have a lot of good surgeons, good doctors, but along with, you have to be a good human being. Somewhere or the other, you have to keep those values, that morality, empathy alive in you. It's hard to stop and smell the roses. I want to be remembered as somebody who took care of the residents, inspired the students, taught them with care, and nurtured them, and made them live their full potential.